Well, every 40 seconds, someone has a stroke in the United States. Every 4 minutes, someone dies from a stroke. How quickly you recognize the signs and get help can be a matter of life and death. Investigator Sarah Goldenberg found in some rural Northeast Ohio communities, stroke death rates are higher than average. One Northeast Ohio hospital now working to change that. Sarah continues our series, Bridging the Great Health Divide.
Every second counts when you're having a stroke.
It's a blockage of a blood vessel. And when your brain doesn't get the proper blood supply, it dies.
In many rural areas, strokes are more common. 19 investigators found 3 Appalachian counties in Northeast Ohio have stroke death rates higher than the national average. Carroll, Tuscarawas, and Holmes counties. Holmes County has the highest rate. Across the country, the CDC reported around 73 deaths from stroke per 100,000 adults 35 or older. In Holmes County, that rate is around 76 deaths per 100,000.
We've really made a lot of progress with treating strokes. And if we get patients in a timely fashion, it's amazing some of the results we've had.
Dr. Bill Reisinger is the director of the emergency department at Pomerane Hospital. The certified acute stroke-ready hospital in Millersburg, Holmes County is providing 24-hour emergency stroke services. It's not the most advanced level of care available. This stroke care pyramid from the American Heart Association shows the different levels. But Pomerane Hospital went through a rigorous review to earn this certification, and it's saving lives.
We've always been proactive with this because it is such a high disability death issue in the area, and we've been very aggressive in treating strokes.
Dr. Reisinger says because they're rural, they don't have neurologists there on call 24/7. But new technology gives them that capability through video calls. Pomerane Hospital was the first in Northeast Ohio to get a Telestroke program, accessing life-saving care through telemedicine.
We get the Telestroke doctor on the call, the neurologist. So when the patient comes back from radiology, we have the CAT scan in place. So we know what's going on, if it's not a head bleed or anything like that.
If medication doesn't work, they can send stroke patients to another hospital, but the specialized training they have is invaluable.
So this is really essential to your community. If you guys didn't have this stroke program, people wouldn't be able to get the care they needed and could die.
I mean, it is amazing to see somebody who can't see on their side, or if they fall on the ground, and with either giving the medication or giving the clot retrieval, they're able to remove the clots. And this is miraculous. Like 24 hours later, they're walking out of the hospital, literally. And the savings that does for the community, for families and the patients, it's just unbelievable.
When it comes to quick access to stroke care, Ohio is doing pretty well compared to some other states. 3 out of 4 Ohioans live within a 45-minute drive to a hospital with the most advanced levels of stroke care, according to an analysis by Kaiser Health News. Sarah Goldenberg, 19 News.
And awareness is the first step to saving lives. You can learn how to spot the signs of a stroke on cleveland19.com/health.
Now you're